Hi, good evening, everybody. I know we'll have some people coming in and joining us in the Zoom tonight. We will be recording this and plan to share it in the near future. Um, to give you all a little background, a group of my friends started this idea of rise up, right, to come above ourselves, so to say, to manage the harder parts of our life. And we started this last year with Kyle Stanley, Martin Mendelssohn, Ricardo Matrani, and Israel Putterman, all of us dentists, and have had wonderful, very successful careers, very blessed. But we all share this common theme as my guest tonight that, it may look nice on the outside, but sometimes it's tough. And how you manage that and how you choose to communicate with others and get help is critically important in this day and age. And thank goodness for guys like Kyle that have made this happen, really push the envelope to get people talking about it. So Rise Up is nothing more than that. It's just another channel, another opportunity for people to talk about the really hard stuff. Our last seminar with Gary Hartman, a brilliant, wonderful person, gifted periodontist that ended up in jail, away from his two children and his wife for 5 years, and what that meant to him losing his license, and what a powerful story. Uh, so tonight, I'm really happy to bring on a friend, a mentor, an inspiration of mine, Mike Sonic from Connecticut, a periodontist and an author, a teacher, and a consummate gentleman. So, Mike, welcome, my friend.
Thank you.
So happy to have you on here with me tonight. And let's get right into it. But the nice thing about this is it's not going to be super formal. Mike and I have had some wonderful conversations over dinner, um, at educational events. We've served on professional committees together. And I've always looked up to Mike. He's my other mentor, Mike McGuire, my partner in practice, and him actually went to Emory around the same time, right?
Yep, he was a few years ahead of me.
Yeah,
So we
and
didn't crisscross. He left like a year before I got there. But
yeah. But I've kind of, I think I've known you since I got into perio, and again because of our professional relationship through the AAP, we've kept this friendship, and you've really done some awesome things with your publications, the textbooks, the study club you have, and your latest, I think, unbelievable achievement is this book you've written that's inspired so many people around the world now, an international bestseller, treating people, not patients. So we can touch on that too, because that's really, I think, a huge inspiration for keeping people healthy and happy, right? Your team, if they carry that type of mindset with them when they're treating patients in the most difficult situations, it certainly lights it up and puts it in perspective. So, with that, um, let's talk a little bit about the darker days, right?
mhm.
When maybe things weren't so easy and we didn't have all the answers and we were struggling, and maybe we've never shared that much, but I think tonight you and I are prepared to do that, and make sure everybody out there listening realizes that you're not alone, that it ain't easy. Having your own practice and building a practice, a successful practice, taking care of people, is a hard job. It's very rewarding, and I think we're very blessed to do it, but it's not easy. So yeah, let me hear about the '80s and '90s for you, and what that was like.
Well, I'll take it back to the 50s, where I was born. So I grew up with, in Bridgeport, Connecticut, in sort of a tough neighborhood. And my father was a World War II vet, and he was a big influence. He was like a larger than life figure. His hands were so big he couldn't hit one piano key with one finger. And I'm a pianist. I play. And he brought up, I mean, this is how I was brought up. You cannot hurt me. You feel no pain. Hard work never killed anybody. So that was the mentality because, he grew up as an orphan in Bridgeport with no money. And he was middle class. He was an engineer and he was a really fine carpenter and woodmaker. And he wanted to be a dentist, but he decided not to be. So there's a lot of pressure on me to do that. Early on in my life, I had some bad bike accidents. That's in my book about I lost my teeth. So I was labeled accident prone. And so it was this weird dynamic where my dad was really tough on me. My mom was being protective, and I was caught sort of in the middle of that. And as a child, I really felt less than. I got labeled. I was sensitive. I never shared this incidentally, but when I was 5, they labeled me cloud because I cried easily. And I was a big kid, so I started fighting my way out of that. But it never worked. Even if I beat somebody up, they'd go to school earlier and say they beat me up. So I was just sort of lost. And so I really grew up feeling less than from the ages of 5 to 14. And then I moved to a different suburb where I was in this inner city school, where I was a minority. And then I moved to a suburb where there was one black kid out of like 500 kids in the school. I felt like I was at a privileged white prep school, which was a public school. It was very different. So I got to start over. And that was fine. But I worked hard and I had a good high school career. But when I got into college, I really didn't care. I mean, that was a waste of my time. I thought I didn't learn a lot. I learned a lot about literature, but I didn't really grow up because I was in the country. And then I went to dental school and I had a real attitude. And I got beat up by my professors. Matter of fact, I had such a bad attitude that one of my professors threatened to kick me out of school. Back then, they could. I did a diagnostic wax up, and everyone was spending 6 hours. I spent 1 hour, doing it because I thought it was useless. What do I got to do that for? And my professor called me up into his office late at night, and he told everybody in the class what he was going to do to me because he showed my wax up to everybody but me. And then he called me up there and he held it up. He said to me, he goes, Mike, what is this? He says, my wax up. And he takes it and he throws it across the laboratory. It breaks into like 5, 6 pieces. He says, no, it's a piece of garbage. And you were laughing at me. He goes, clean your act up. And it was at that point where it was like that, aha, I better do something. So I became a workaholic in school, which I never worked that hard. I did really well. And he actually wrote me a recommendation. His name was Joe Grasso. He wrote the textbook on removable partials. And I had a good residency program, and I was there with Tom Van Dyke and Offenbacher and others, and I did really well, scored really high. Everything was like I had to be the best, and I was arrogant, and I was better than everybody, and I had to score the highest grade on everything, and I would do that by working my ass off. And then I got out of there, and you know, I started to work, and I went down to NYU, and I started to teach. I taught with Dennis Tarnow, who was 37th at then. He wasn't, a big name. And I opened up my own practice because I was so arrogant that I couldn't work for anybody. I didn't have any mentorship. I just couldn't do it myself. So at the time, it's 85, I went into a tremendous amount of debt. Well, back then it was a lot of debt. Today it's not much. It was $400,000. And I had no patience. So I opened up, I was the sixth periodontist in a town of 65,000 people. So that was my attitude. They go, you're not gonna make it there. And the first year I grossed 35,000. And the second year I did about 65, and I didn't really do well for a few years, but I worked my butt off, and I was really felt like I was better than everybody else. And I had a really, really better than attitude. I was an egomaniac. I was an asshole. And I did not build my practice the normal way, as most periodontists do, by taking and playing golf and being really nice. I was an educator, so I'd look at their preps. I'd tell them that they weren't prepping the teeth right, there were overhangs, and it's just like I made them show their attempts to me before they went through. And of course, with that kind of attitude, the practice didn't grow very fast. But I had a very loyal following. And, it took a while. It took about 20 years to become successful, and I did not have a lot of mentors at that point in practice. And I became successful. I got married, and I was sort of married to my work more than anything else. And not my wife, but I didn't marry the right person because I was a workaholic and I did everything to excess. Sort of addictive behavior. I was a long distance athlete. I was a triathlete. I would just work. I was working out 35 hours a week and working about 80 hours a week and teaching and educating. And, I got divorced in my mid 30s with 2 little kids. Felt like a complete failure. As I'm trying to build the practice. I was, I had to, it was just very I was very embarrassed. And I left my marriage with with nothing. I left my marriage with $75,000 at around the age of 40. And that's all I had. I had no property, nothing. And so I had to start all over again. And then my mom got sick, and then she died of cancer, and I had a little baby at home, and my septic tank went, and I had no money. I couldn't even fix my septic tank. I had to find lines of credit on credit cards to pay for that. It was nothing. I didn't even have enough credit anywhere. And I'm walking around at my mother's funeral with a broken septic tank and a 2-week old, I'm sorry, a 2-week old, and another daughter who's 4. And I'm thinking like, what a loser I am, you know? And so I decided I would become a real estate investor and to make the money back. And then I went bankrupt. About 4 or 5 years later, I went in with some bad partners. I was the only one making money. They all left the country or the state, and I was left with $2.5 million in debt on property debt. And so I negotiated with the bank to give them the land for the money. And then the bank was taken over by the FDIC. I remember I was getting a massage on Saturday morning, and I'm getting a massage therapist is working on me. He's an ex-highlight player, and I'm listening, and it says the FDIC is taking over Merchants Bank. I'm thinking like, I just signed a deal with them 2 days ago. So no, they no longer existed. So now the FDIC has my land and my note, and that $2 million went up to like $6 million because it took 4 years for them to get to me. So now I'm going bankrupt. I have no money anyway, and divorced. And so what do? I work hard, and I get a loan. I get another loan from the bank,
Okay.
and I buy a big office building, big building I'm in now. That was over $1 million. I thought that was a good deal because the periodontists owned it. Turned out I put another 1.5 million into it. Now this is like 25 years ago when I have no money. So now I'm $2.5 million in debt here. Just went bankrupt. And I decided not only to build the building, but to open up a teaching center at the same time and to digitize my practice all within like 2 weeks. So no business plan, no mentorship, going out and doing everything and thinking I'm the best in my town at what I do. And to talk about the tension that I had. So every day, I'm not exaggerating, for like 25 years, I thought about nothing but how do I pay off this debt? I never really thought about making money. I just thought about paying off the debt because like a lot of my young friends who are in their 30s and 40s, they're thinking about multiples of their practice and they're going to pay it off. I didn't think about that at all. I just was totally out of my mind because I didn't have a plan and I just thought I could do anything. And my note, it was $150,000 a month and 4 different accounts. And this was like, I don't know, 30 years ago. And, I just put my nose to the grindstone and I worked like 6 days a week, to pay it off. And now I am really successful because it looks at me. I got that big building. I got the teaching center. I got the conferences going on there. I got people like you coming to visit all the time. And people think that it was really, really easy. And, having 2 kids from a first marriage. And then I got married again to a wonderful woman. She had a son who I sort of adopted. I pretty much did. And so now I got 3 kids and, now back and forth in separate houses. And it was really very stressful. And then, I sort of crashed and burned. I was pushing everything to excess. And I went through about 20 years ago, I just crashed and burned. Everything sort of fell apart. And through the help of friends, my wife, my closest friend, who was my workout partner, and groups of people that I connected with, I pulled myself out. And at one point, I thought like that was it. It was all over. And now people come to see me and they ask for mentorship. I'm sort of known as a mentor for a lot of the people that I work with. And it's only because I've gone through almost everything that everyone else has gone through. I've gone through not everything, but quite a few things. With surgical complications, as you know, we do a lot of things. I'm good at handling them because I've had almost every one. It's not fun to go, oh, and if you haven't had them, then you're not doing a lot. So if you haven't really lived this kind of a life, it's sort of hard to actually know anything. Because I don't think there's a straight line to the top. A lot of people go, oh, how do you become successful? And I have 3 kids and I've mentored all them, but they're all in their early 30s and they're all struggling right now. They're doing well, but they're all struggling. My daughter just bought a dental practice. My other daughter is in Manhattan. She works in the music business, which is not the easiest business, especially for a female promoter, which is one of the few in the city. My son's in commercial real estate, which is a shark place. They all sort of like, now they're in their 30s. They're doing what I did and probably what you did. And it's been a real blessing because what I've done now with my life, as you know, is like I really like to talk to other people what's wrong with them. And I've helped a lot of people. I always say that I'm probably the most successful non-paid mentor in the United States. I have made people millions of dollars by giving them advice on my mistakes, and I've made a lot of them, almost every possible mistake. And I was watching my daughter buy a practice now, negotiated. I see people try to play games with her and she doesn't really know what's happening. And I said, here's what they're doing. Watch for that, watch for that. And it's sort of interesting to watch. And it took me a long time. I probably didn't really grow up until my 50s. And I had a really good relationship with my dad when he passed away. My mom died in my arms at a very early age. She died of cancer. She just threw an embolus and died after chemotherapy. And my father and I had a good long relationship, and we worked out a lot of the differences that we had because I'm in the town. I'm 200 yards from my high school. I moved my first place that I bought, this little condo, was on the street that I grew up in. So I used to jog on the street where I used to get beat up and be called, all sorts of names by the neighborhood kids. And there weren't many Jews in the neighborhood, and there were some mean kids. They told me I killed Christ and I was going to die in hell. And I believed the stuff when I was 6. I ran through those streets as an adult saying, "Oh, I'm no longer 6. I'm no longer that." And I got to work that out. And now, I'm older. I'm in my 70s now. I get to look back at my career and say, what did I do well? What did I not do well? The one thing I did do well, and I never varied on at all, was I always had a commitment to doing the best I possibly could with my patients. I put my patients first. And I think that's important, but sometimes I sacrifice my family. Sometimes I sacrifice my own body. And sometimes I sacrifice my team. And I've come to believe, as you have, that mentorship is probably one of the most important things in helping you grow. And if you don't have a mentor, you don't have a really good mentor, find one. I have right now many mentors. You say, I'm your mentor. Todd, you're one of my mentors. I remember you when you first got started and had so much respect, when you were talking about provisionalizing of restoration and talking about ortho, some of the things that you talked about early. I remember those meetings and sitting down talking to you, I go, boy, this guy knows a lot for a young guy. He really works hard. And so maybe too hard, as I do, because I still work hard, and not because I have nothing else to do, but it's sort of like I've been doing it so long. We become so good at doing the same thing. Is there, I was just talking to somebody right before this meeting, and a good friend of mine, sort of, we talk a lot. I said, I'm going on. He's not a dentist. He sells, he's in Houston all the time. He rents the tankers. Okay. So he's always in Houston. He's an oil guy, which are not too common in Connecticut, but the tanker guys are. And I said, what should I talk about? I'm going on. I'm going to talk about this, not what makes you successful, but the things that you have to go through to become successful. He goes, talk about discomfort. He goes, because nobody doesn't have discomfort. And if we try to avoid it, we're gonna have it. I'd rather have the discomfort trying to get better than the discomfort, by avoiding, the problem. And there's a book. If I'm talking too much, Todd, just tell me at any point to stop, because as you know, I can talk forever.
Yeah. No, go.
There's-
But let me say one thing because you
yeah,
just brought it up, and I think it's important. So many of us, we manage our stress through plowing through it,
right.
right? So it's not, and that's, I think, kind of where you and I came from, these places with very, I grew up on a farm in New Hampshire,
Yeah.
with a father that had a work ethic that like no other. And it was a very valuable lesson for me. But managing stress by plowing through it isn't always the right answer. And I think that, you and I share that, is that our work ethic is next level, and that's what's helped make us successful. But it's also where perhaps we didn't make the best decisions because we weren't thinking about our family, we were thinking about our job,
Yeah.
or vice versa, right? We in the moment we were in, we didn't channel that stress for the right reasons. It may have worked out for us, but in retrospect, I think through this kind of self-realization process that we've been through, is
Yeah.
that we learned that you got to think differently sometimes and get help and let people guide you in perhaps a different way than just plowing through it.
Yeah, I agree. And I think I don't know how spiritual you are or religious. I'm not religious. I grew up, having to go to synagogue and do all that. I actually turned my life, my on the most holy day of the year when I was 18, Yom Kippur. I went to the top of a mountain in college, and I turned to God. I go, I no longer believe you. I'm done. I walked away, and I didn't come back until, later on. About 30 years later. And I actually took my son up to the top of that hill, who I adopted. He's my stepson, because he went to the same college. Both went to Colgate. Went to the top of this little mountain, and up there, I told him, I go, I'm so happy God brought you into my life. I said, yeah, go. You've been one of the biggest gifts of my life. We both started crying at that time, and that was at the same rock that I. There are no coincidences there. So that gives I'm getting goosebumps just talking about this. So that whether spiritual or not, Albert Einstein, toward the end of his life, he got pretty spiritual, and people go, "Do you believe in God? How can you believe in God? You're a man of science." He goes, "How can you not?" And so we proved that there's not. So whether there's God or not, there is something out there, that if I connect with it, it helps me. The easiest way for me to channel this stress, Todd, is to just look my patient in the eye and just be present with that patient in that moment. That's part of the reason why I still love to go to work. We get to go to work and help people, get paid for it, do something we enjoy, and actually get spiritually connected with the patient that we're treating. And it's just like it's a real true gift. And people, I mean, people every day they say thank you. I can't believe they say thank you. I do something that takes me 20, 30 minutes, and they've paid me a lot of money for it, and they go, "Thank you so much for taking care of me." And it really wasn't for the procedure. It was like you were present there. And that was really pretty cool.
Yeah, I think, that I'm glad you brought that up. I think that one of the things that's profoundly affected me in the last few years as I battled, um, some my daughter who kind of went through a tough spurt there with anxiety and the social scene of a 14, 15-year-old kid. And that really made my wife and I, um, you know, talk about this and talk to a therapist really for the first time in my life. And one thing I've learned through this, not necessarily through therapy, just through self-realization, is that you have to be present, right?
Right.
You can't always be ahead of yourself, right? Slow down and be present. And something that Ricardo Madrani, who will be on our next Rise Up in July, he and I are good friends, and he same type of thing. He looks at me as kind of this overachiever, and man, how's he doing all these things? And I saw him at a meeting recently, and he could tell that I was stressed, right? He could see it in my just standing there. He could tell, and he said to me, "Suspend judgment." And if you think about that statement, and wherever you are, whatever you're doing, if you suspend judgment, it gives you a lot of freedom to relax.
Yeah.
Suspend judgment of the stresses in your life, suspend judgment of the person, the patient that maybe isn't the best patient, or the staff member that's really making your day not the best today. Just suspend judgment, relax, listen, take a deep breath, and you're probably going to have a better viewpoint or a better self-awareness of what to do next. It's a powerful tool, right? If you start really thinking about the stuff I never thought about, right? The subconscious mind,
Yeah.
the spiritualism that you just mentioned, whether you're super religious or not, everybody should have some level of spiritualism to help ground them. And then that whole idea of suspending judgment and grounding yourself and slowing things down a little bit, and enjoying those patients that are in your chair thanking you for just doing a surgery on them and paying you a lot of money to do it. They're really appreciative of your gifts. So that really reminds me of I think one of the main things that you and I can share with listeners is slow it all down by a little bit more self-awareness, and it's a powerful, powerful tool.
The there are two tenets that I live my life by, and one of them is suspending judgment. I call it acceptance. The same thing. So I have to accept whatever's out there, we have both of us have a lot of employees. Not one of our employees has our brain, but we want them all to think like we do. It is, you got to sort of say, all right, they're doing the best they can. Some people don't have the intelligence, some people don't have the ability to handle stress, they lose it. And so I always look, am I in acceptance and am in gratitude? So when I'm in those two places, which was suspending judgment, then I'm okay. And every day there's something that's bugging me, right? I'm a bit of a perfectionist. I want everything to be perfect. Whether it's the light that went out today, my big problem is the light went out in my hot tub. Okay. That's my
Yeah.
big problem today.
Yeah.
The
Right.
guy came up and is afraid and he already repaired it. And he's asking for electric tape. So that's my big problem today. Someone took a hubcap for my car and I'm too lazy to make a phone call to get it fixed. These are minor things, but I've also had other problems. I had a surgical complication this week. It was sort of a big one, and I had to own it. I had to run right to it. So it's I think we're very blessed that we able to get to do what we do. But oftentimes we forget that part and we go, God, I gotta do this. I gotta do this. Because like, I don't know about you, but wasn't like, I can't wait till I'm 6 and then I can't wait till I, get into high school. And then it's like, okay, I'm a freshman. I want to be a sophomore. And I want to be a senior. And then you want to graduate. And then you got to get into college. And you get into college finally. May not be the college you wanted, but you didn't tell people wasn't the one. And then you got into dental school, and then finally, then residency, then practice. It's like, when do you get? I had a good friend, my accountant. He passed away of Lewy body disease, and I remember I was living in a basement apartment in New Britain, Connecticut, driving an old beat up Subaru, and had no money. My rent was only like $90 a month, though. It was pretty good. Yukon back then wasn't that expensive. And my friend came with new loafers and a nice suit and drove up in a Porsche because he was an accountant and he still was miserable. Then he got a girlfriend. He still was miserable. Then he got new clothes. He still was miserable. Then he bought a condo on the water. He was miserable. And he never, and I always looked at him. I go, it's not the achievements. It's who you're being. And then he finally made millions of dollars. He bought this business after he was fighting with them for years. And then he gets Lewy body disease and he dies. And I just watched his life. And his life is the life that I look at of like, this is what happens when you're miserable. Did he get it because he's stressed? I don't think so, but who knows? Stress is a big modifier and it's a huge one.
Yeah.
I think stress can destroy anything, can lead. I once was invited to a restaurant, a bar, by referral. This was early in my career, and my mortal enemy was there. I didn't dislike him, but he hated me. He did not like me opening in town. He was older than me. You know the guy too. He's not a nice person, and he just did everything possible. He would send out emails about me. He'd say I mistreated people. He said I did fraud. He was always after me, and I was invited to this bar to meet this referral dentist, and I get there, and he's there. She invited two periodontists that were 200 yards from each other. And I get along with all the periodontists, but this guy, he's just nasty. And I wanted to leave, but I didn't. I felt like I had to for the practice. And it was the only time that I can remember where stress really caused a psychosomatic. Well, that's the only. Actually, I'll tell you one other story. I went home that night and I went to the gym to work out with my trainer. This was like 30 years ago. And I got vertigo. I've only had it once. And I knew that vertigo was because of my stress. And I had to take the day off and I had to get meclizine and take some medication. So it really dramatically, I mean, there's forms of ANUG that's caused by stress. I don't know if you know this, but the T cell relationship changes. It looks like you have AIDS, active AIDS when you have ANUG, some of these patients. So it's a really huge modifier. So how do you get out of stress, when you're there? I mean, you cannot think your way to serenity. Because like your mom used to say, or I hear my wife saying to son, just relax, just have fun. It doesn't work. It doesn't work that way. And it requires, as I'm talking about I take really good care of myself now, but I didn't always. And when I was in my early career, it was like I sacrificed my body, to be successful. And it wasn't a really good thing. And I'm watching, my children as they're trying to become successful and trying to make it. And they're not taking as much self-care. And I'm worried like what's going to happen to them if they don't take care of themselves, do all the things that you need to do to take care of yourself. There's a whole list of them that are out there. And,
Yeah.
you
I
know,
mean, some of the powerful tools though that I think all of us can use as because let's face it, dentistry is a stressful job in and itself. Just the technical, physical, mental strain, visual strain on us, postural strain. It's a tough job. It's a physical job. Then on top of that, you add the people, the good and the bad, and not just patients, but the team members in a specialty practice, the referral relationships. This is a recipe for disaster, as Kyle will say. There should be courses preparing you for this because this is the reality of it. It's not. This isn't a secret. We've known as long as we've been doing it, and long before that, getting into dentistry is getting into a very stressful occupation. So there better be some preparation and self-discipline to manage it. So I do think that, just talking about this and sharing how we've managed our stresses through your over 40-year career and my now coming on 25 years, it's taken me, just like you said it earlier, you didn't really grow up till you're 50. It took me till I was 50 to really learn how to really manage stress, because before I was just plowing through, right?
yeah,
Just so how I managed my stress was keep going, man. Just keep going, add another thing onto the fire, another log on the fire, and just keep on cranking it out. And that's only going to work so long. We're all human. We're going to get older. We're going to have to focus more on our health and well-being because we're getting older. And a huge part of that for me in the last few years has been really, really looking at coping mechanisms for the stress that we encounter every day. I mean, I kind of feed on it, quite honestly. I think it's part of the drug that keeps me
yeah,
happy is the stress. But I am also not stupid to know that it's not beating us up too sometimes. And therefore, when you're feeling the negative outcomes of stress, how are you gonna get yourself out of it? Like you said, it's really hard. But there are. I mean, there's simple as that is pick one thought over another, right? Think of that person you've got to go talk to because they help you out of that situation. I think that you and I both wouldn't be as successful as we are if we weren't surrounding ourselves by amazing human resources, whether it's
yeah.
our family, our team, our colleagues, mentors. That those are the people that lift us up when we're feeling pretty down. I got to tell you this, and I've said this to a lot of dentists that come up and ask me when I start talking about our practice and the research and the education and the clinical practice, and now a growing organization, that how do we really manage all this? And I said, well, I may be one of the leaders, but it's my team that really allows us to do this, and specifically project managers. I know Jackie's on right now, and Jackie's, I think, my third, fourth, or fifth project manager in the last 5 years, because it is an essential component to my success. Having someone, a right hand that's there almost all the time to help me battle this multidisciplinary concoction that we've got going. So the team support, the best thing a dentist could do if they're wanting to grow and make a direction towards growth, or just maybe not growth, but more stability, is having a project manager. It's not an office manager necessarily. It's not someone that's going to be running the whole business. It's someone that's going to be helping you focus on what you need to get done every day to help the organizations move forward and not forget stuff and keep on track. So I don't know what your thoughts are, but I mean, I think that's my most powerful message to young folks today is don't be afraid to hire an extra fractional employee.
Yeah.
It's not necessarily a chairside assistant or a front desk treatment coordinator or an office manager. It's a project manager, because you know what? Project managers, if they're good, that's what they do. They manage a project, they finish it, and they move on to the next with great vigor. And that's helped us, our organization, immensely to have project man. In fact, most of our project manager, maybe not most of them, but at least two have stayed with us in other capacities. So it's kind of their entry point to showing that they're incredible multitaskers, They can manage projects, and then they can also move on to do something bigger and better as they evolve.
Yeah, no, I think it's important. One of my mentors, Dan Sullivan from Strategic Coach, says, you need a who if you're gonna do something new. It's
Yeah,
usually a who,
that's a great book. Yeah, by the way, that I just read that book.
who, not how.
Yeah, who not
It's
how.
really,
Yeah.
it does require you to hire right. That's just a whole different skill set. There are there are four basic things that I look at. Um, if you're going to stay healthy, it's one's diet, other one's exercise or movement, sleep, and management of the stress, which is mindfulness. And I'm not going to tell you what my thoughts are on diet because everyone has different thoughts, but just eating a relatively healthy diet, not overeating constantly. I think it's important to exercise every day. I've developed some habits. I've been very fortunate that that's one of my habits. I do that every day before I go to work. I've done that for a long time. And I try to sleep. I wear an Oura ring. I try to monitor my sleep. If you measure something, and I think what's important is like you have to define like what are you going to do to have this life? Because if you don't, you don't have any guidance. You don't have a plan. What does it say? Without a roadmap, you're going to get there every time. I mean, you don't know where you're going to end up. And I've watched, I'm a member of a lot of organizations of people that talk about longevity and abundance and things like that. And what I see is that people are becoming a lot more thoughtful about managing lives. So here's what I see. People work their ass off doing every job in their organization to become extremely successful. Their bodies are broken. They're 50, 60 years old. They're a mess. And they go, okay, now I'm going to take care of myself. It's sort of like I'm going to retire at 70, but I'm going to start saving at 62. So it's, if I knew I was going to live this long, I would have taken better care of myself. So I think support of the right people, what I say, you're an average of the five closest people in your life, so keep good people close. I always say that to people that I'm close with. They go, why are you hanging around with those people? They don't make you better. So I like to make people better. I like to be this, not the smartest person in the room. I like to have a lot of people that lift me up emotionally, physically, spiritually, intellectually. And I think that's important stuff. But those four things are important. They talk about the blue zones, which I don't know if I believe the research from it, but it's the sense of community I think is important because how much time do we spend at work? A
Yeah.
lot.
Amazing. Yeah.
Yeah, we want that team. And, I know you have a huge network of people in our field, as I do. And, I lean on those people a lot. In my speed dial, my phone. I mean, I don't know if do you have a speed dial on your phone? Do you have phone
Yeah.
numbers in here?
Yeah.
I mean, most of the younger people don't. Okay. I have 50, I use the whole as Apple phone. I can put 50 numbers in there. I got 50 numbers in there. Okay. I have like the family, then I got some professional people, then I got some dentists, and then I got about 20 people that I can call when I got a problem. Okay. These are just regular people that I have relationships with. Like my friend Kevin, who I called right before I came on here. I go, what did you say about discomfort again? He says it's important to be able to handle discomfort. And let me talk to you about the anxiety curve. Did I ever talk to you about that? It's like
No.
when we're under stress, this is what we think. It's going to get worse and worse and worse. I can't handle it. I can't handle it. Well, you and I have been under tremendous stress our whole lives under various things. None of those things killed us, but we always think this is the one. Okay. So I'll share this week. I had a surgical complication. Never had this happen. I placed in an implant with an osteotome lift. I put the cover screw on and the implant went right into the sinus. And it went posteriorly and up. And so now I have to wait a lateral window. It's a long procedure. I opened it up and I can't see the implant. So I have to now refer this patient to an ENT because I don't have the scope to go through her nose to get into that area. And so I didn't like that complication as was happening. It was really annoying. And I'm thinking like, so my team goes, so 40 years, first time you've seen this? I go, yeah, I'm 72. Could they give me another 3 more years before I get out of here? But I followed up with it. And I knew it's not going to kill me. It's not going to kill the patient. I had the relationship with a great ENT at Yale. I got her in there. She's taking the implant out and it's going to be fine. But going through it and not running away from that sense of discomfort, which was the worst complication I've had in a while. That's what I have to do. And I've had tremendous amount of discomfort in my life, but none of them have killed me. So one of the concepts that I have now is what is the right thing to do in this moment that's best for me and the people that I'm serving. And then I got to let go of the outcome. So I can't control the outcome of my business, of what my kids do. I brought up three teenagers as you have. We both have three kids. Things happen that are going to be out of control. We're going to get that phone call. I've gotten some terrible phone calls about my children at various times. It's all worked out. They're all doing okay. And if it doesn't, I got to sort of accept that too.
Mhm.
And so, how do I manage the stress? I just know that whatever I'm going through is not going to last. But it took me a long time to realize that because it was the
Yeah.
worst thing in the world. I didn't get a good grade in that test. I thought I took anthropology in college, thinking it was going to be a gut course, and I got a C. It brought my cume down. What isn't none of that stuff matters. And that stuff matters. But the things that I thought really mattered, all those achievement things aren't important, aren't that important. And I see a lot of people our age, you see them too. They're giving each other these awards. I know these people are miserable, but they're hanging out, posting their pictures of giving themselves the little banners and award. And some of them are doing it for fun, but some of them are pretty still caught up. I'm thinking like you're 70 years old and you're still acting like you haven't made it yet. So I have a very, very well-known patient. He's in the real estate business. He's a billionaire, and he came in. My mom used to work for him, and he had two cell phones, and he canceled 5 appointments before he saw me. I really wanted to see him as a patient because my mom worked for him. She had passed away 30 years ago, and he's a local legend in my town. He grew up poor as hell, fifth floor walk up, and now he's a billionaire, and he owns property up and down the East Coast. And he comes in, and it turns out he's dental phobic. He's got the two phones going. And I said to him, I said, how many employees do you have? He goes, 4,700. I don't know if I've told you the story before. And I go, that's a lot of employees. I go, how come you still have two phones? And he looks at me. I go, you can't get anybody to do that? I go, your problem, here's your problem. You still haven't made it yet. And he turns to me and goes, go fuck yourself. And, he was, and we laughed. But it was
Yeah.
like, he hasn't made it. I know him well. I've gotten to know him well. He hasn't made it in his own mind. He's like 80 now. Some tragedy has befallen him in the last couple of years, which is really bad. He lost a wife and a daughter-in-law, one tragic accident. And he is just like, all that stuff doesn't matter, at the end of your life, what matters most is those close, meaningful relationships. But I get caught up. I'm not going to speak for you, but I get caught up in the status. I don't need a big house or big car. I don't that, but I want to be known as the best at what I do. I got to be known. Oh, I got an invitation. Oh, thank you.
Yeah.
It's it's not a healthy way to be. And when I'm like that, I immediately know because I've done a lot of deep work as like you have. I always know it's me. And what do I become? I become a victim. And that's when I become sad or depressed or anxious or feeling less than because I'm a victim and I'm thinking like, it's your fault. It's your fault. But the answer is right here in me.
Yeah.
How do we have access that? That's hard to do. I
Yeah.
could,
Yeah. Yeah. But it's a self-awareness thing. I mean,
yeah,
I'll bring that back to, what we go through as kids as of lots of discipline in our life. It really helped us become successful, helped us live in that time of what you call pain or your hard times. You battle them. You're good at it, right? You're always been kind of really good at managing this. You think at least that you're managing the stress, and you're going to recapitulate that attitude to your children. And I had to learn really fast that my tone or my demeanor, being the disciplinary for my kids, was making them worse because of their anxiety, their immature brain development. Any tension, anger, discipline really puts them into a state where they can't manage good comprehensive thought. So you have to be able to step back and not be that father that's pointing the finger and shouting at you and disciplining you. You have to just be the person that's listening and in loving. And man, to not learn that until you're in your 50s is a travesty. So anything we can do out there on a personal level with their families, but their teams, helping. I was just recently, I heard about and this periodontist, very well-known periodontist in Los Angeles. This man I met was in the military, and he gets out of the military and he's wants to live in California. He goes out there and he has an interview with this very well-known surgeon, and he gets a job. And he's like, I got to ask you, I'm a young guy, and I'm not from California. Well, why'd you hire me? He said, well, not many people will work with me because this very successful surgeon yells and screams and throws instruments, and that's his way of managing his team. And if you can fit in, and so the guy he hired, because he had a military background, he figured, well, he's good at taking orders, right? And that's how the atmosphere of that office is that it's a very it's a dictatorship. And if you're not falling in line, then it's not a good place for you. So I think we all can learn from our backgrounds and how, whether it was, very strict and stern, and that's just what we do, is that, this day and age, it needs to be different. It's a crazy world we're living in, and kids need a different level of support. And sometimes it's just, a big hug and I love you. And man, I don't care what you did. I'm still here for you. And as long as you remain honest and you come to me when you're in need, then I'm always here for you. And that's a message that I never got really as a kid, but I sure know how important it is now.
Yeah. Yeah, no, that's important. And not only with our kids, but our team, because, I look at myself as being almost everybody's parent now. I'm at that phase of my life where, they come to me, and, my team is my kids' age. They're all 30. The average age in my office is what, 38, 40, my dental assistants are at 70. So, although I have a hygienist that's older than me, she's been with me forever. She's great. I think that's important, to be kind and not to be. I had a conversation. I have a number of men's groups that I'm a member of, and I was with one last night, and there was a very angry litigator there who's a skier. He's 62. He still skis at 60 to 70 miles an hour up in New Hampshire, and I mean, he's nuts. He's one of those crazy guys, and he's a litigator, and he gets angry. I mean, he was ready to fight people at 62, and we were all looking at him like, really? I mean, you're still doing this? I go, you're a lawyer who fights for a living, but do you really get emotionally involved? Like, I never get emotionally involved with my patients. You probably don't either, Todd. They never bother me. They're patients. I mean, they're scared to death when they come in there. I always say to my patients, I go, this is why I love to treat a divorce attorney, because I say a divorce attorney is the same thing. I go, you and I are very similar. We get to see people at their worst, where they are just scared to death and they got to spend a lot of money. And our patients come in scared. And so that's an opportunity to make them feel good. And the same with my children too. They don't have our brains. They don't understand it. I try to be really, kind when I can. I just try not to yell at them. And, they're tired of listening to me anyway. They come to me when they got a problem, but I can't really teach them what to do when they want to. I've come to the point now, Todd, where I don't think I can teach anybody anything. They come to me when they're ready to learn something. Every time I give a lecture, I'm thinking because during a like when I was down lecturing for you, I must have said 10,000 things during that day. If one person left with one thing, that would be a lot. It's what they hear. Because I sometimes well, here's something. Oh, yeah. Someone say, I've been saying that to you for years. I go, I heard it for the first time. Usually my wife. I said that to you. I really never heard that.
Yeah.
Yeah, I think we all have that experience.
A couple of things I want to make sure we fit in here. We're coming up on 50 minutes. I think we maybe had to set for 80 minutes, but I'd like to, with the folks that were live tonight, I want to open up the chat room, and I want to ask, because I think resources, right? That we've talked about stress, right? I think we've definitely shown that two successful people have been battling stress our whole career. We had times that weren't so easy. Maybe on the outside it looked like it was, but it was killing us. And we weathered the storm, mainly through support, right? Of key staff members, key team members, mentors, friends, and family. And then for me, and it sounds like you too, one of the most powerful tools when I'm on my own island is this mindfulness, right?
Yeah.
Self-awareness, building the subconscious, letting those things out, I think has been something extremely powerful for me. And this happened to me through a functional medicine doctor. I think I told you about him when you were down in Houston, but I switched gears. You know, I was having what I thought was sleep-related depression. It wasn't. My sleep was actually being treated very effectively. It was stress, and I couldn't, no matter what, figure it out until my doc, functional medicine doc, a brilliant guy, took me off all. I was on, you know, my dad had a heart attack at 54. I actually resuscitated him when he dropped, and he had another round of VFib and passed. And, you know, those are the type of traumas I dealt with as a kid that I never really uncovered. I never really let them out.
Right.
So it's Dr. Ron that helped me really figure out how to get off my preventative cardiovascular meds, my statins, other supportive meds when you take statins for a long time, got off a bunch of supplementation. My liver enzymes were high, and he told me, he said, the liver and the central nervous system are direct linked to each other.
Yeah.
And I believe that it's not because I'd quit drinking, it wasn't alcohol that was my liver burden. It was really this stuff that I hadn't unloaded. And how do you get there? And it's through really mindfulness. It's really, you need help to do it first. And he was that guy that helped me get there. But as I started unloading these things, like my father's death, and a dear friend of mine that, was an alcoholic, and he had a car crash and was in a coma for 30 days, and he came out and he kind of recovered and started drinking again. And the next car accident he got in, he killed himself and his brother.
Mm.
What? Right? I mean, these types
Yeah.
of, they stick with you. Even if you say, oh yeah, it's all good, get back to work, get back to your normal thing. These powerful episodes in your life really, really stick with you. And if you don't talk about it and get it out there, it's going to have a strong hold on you in a both mindful way and perhaps other systems in your body. And I'm a true believer of this now, having seen all my liver enzymes, everything is corrected. I'm on no medication. It's all been in 1 month, 1 year. To see this happen has been remarkable. So I think that folks out there battling stress, obviously you don't want to turn to drugs or alcohol to get through your stress. But think a little
But
bit
that's
deeper.
what most people do.
That's what
Or
most people do.
food, or sex, or gambling, or just watching TV.
Right. Some type of outlet to help them battle it. But I believe more powerfully now, more than anything, that this mindfulness can do wonders for us.
So how do you get access to the mindfulness? I think you got to be mindful, and then what do you do with it? Like, all right, I'm mindful now. Okay, so I'm self-aware. Like, I'm a jerk. I'm an asshole. It's like, how do you get out of that? And how do you find that sense of peace? There's a key to that, and there's a lot of different ways to do it. I think exercising in nature, walking in nature, meditation,
Yep.
prayer,
Yep.
yoga. I think yoga sort of checks a few boxes because you get the meditation and you get the stretching and you get the exercise.
Well, I
You know,
think
I,
that
I would tell you something. I never say this, but if I'm having trouble taking out a tooth, I actually ask for help, and I've never had a trouble. I've never broken a tooth when I've done that. It's like it just sets it, and I've done that for 30 years. I go, let me help. I never ask God for anything. I go, I ask for alignment, your will,
yeah,
not my will. And it's crazy, but I've been doing that for 30 years. It's practice management tip. Okay. So
no,
pray when you're having
that's a good one.
difficulty. But
Yeah. Help yourself, right? Help yourself get out of that. I mean, I think you brought up a good point, but how do you, once you become mindful or more self-aware, what do
then
you do
what?
with that, and where do you get started with it? I tell you that there are tons of opportunities for
Yeah.
dentists out there, and Kyle's got a great program right now with Martin Mendelson. If you just Google Kyle Stanley, you're going to be able to find his programs. One of our viewers tonight, I think, is on. Ron Hickerson's been through the light side. Perhaps we'll ask him to make a few comments on that in a moment. There are great resources for dentists out there right now, better than ever before. Ask someone to come speak at a study club about this, that to your study club, that brings up awareness about mindfulness, and the fact that you're not alone out there, that there's a lot of other people that are ready and willing to share or just listen. to help you get through the demanding, very stressful occupation that we're living in. I think that we've got to help each other more. And that's what tonight's about too. I mean, you've had to listen to Mike and I talk about, our careers and how blessed we are today to feel like we're more mentally strong than we've ever been. That didn't come without a ton of mistakes, a ton of, really failures in finding help or asking for help, because that's just not what we do. We're too tough for that. I think coming to that realization that everybody is human here, and we need a lot of help to get through the battles of managing a successful practice and giving ourselves the ability to help those patients. If you're not present, you're probably not giving your patient the best you can, right? If you're not present in the moment, really mindful of what you're doing, who you're treating, what their problems are, it's pretty easy to get led astray if you're stressed. You're not so focused on that implant. It may just end up in the sinus, right, Mike?
It may, it may, things can happen, there are complications with what we do.
Yeah. So any other resources you can think of that, or maybe that just things that you found other than what you mentioned as far as meditation, exercise? It sounds like for you, your day starts every day with some self-focus.
Yeah, I start every day with, I get up, I do a 2-minute meditation type prayer just to get set. I get a cup of coffee and I get on the exercise bike and I work out for an hour to an hour and a half. And people say they don't have time. And that brings us to the second part. So I work out every day. And I think that if I go to work, it raises your endorphins, it decreases your stress, it decreases cortisol. So you go in there and you're feeling pretty good. But also, it starts on the other end by going to bed early enough. And
Yeah.
so a lot of people, when I grew up thinking that sleep was like, well, I'm not a wimp. I can go on 3, 4 hours of sleep, but what we found is there's a lot of work by a guy named Matt Walker. He's out in California. He talks about the importance of sleep, and you need 7 hours of sleep if you're going to heal. And great athletes, they don't cut on their sleep. Michael Jordan never cut on sleep. The LeBron James, he's 41 years old and he's a phenomenal shape, but he sleeps 8 hours every night. It's important. It's important to do
I
that.
think if I could interject on that, is knowing as much as we know about sleep today, if you're not getting that second round of regenerative sleep, REM sleep, you're cutting yourself short. You really need that first hour, hopefully hour and 20 minutes, and second, if you could
Right.
get another hour and a half to 2 hours of it, that's truly when the cells in your body rejuvenate and get what they need to fight off cortisol levels. If you're interrupting your sleep, not even sleep apnea, but sleep disordered breathing, upper air resistance syndrome, you are spiking cortisol
Right.
that will, even if it doesn't wake you up, it will create anxiety in your life. And if you add alcohol to that, you're multiplying the level of anxiety you're going to feel the next day. So what do a lot of people do? They drink the next day because they think that's going to be their solution towards reducing anxiety. It's just fueling the fire to have more anxiety the next day.
Yeah, you do a lot of lecturing on this topic.
Yeah, and it's crazy as you really dive into it. It's right there. It's not rocket science. This is very basic physiology, and you hit the nail on the head, man. I mean, you got to get that regenerative sleep, and if you don't get it when you're young and strong, you buy, just like me. I was the same way. It's like, oh, 4 or 5 hours, that's fine. I get up, I'd still never feel tired, just keep going, but that's only going to last so long. And if you really want to get the best version of yourself, you've got to figure that out. And it's been a profound journey for me the last 5 years, is figuring all this stuff out. And I'm by no means have it all figured out, but I feel like I've got a lot better coping mechanisms for my stress and anxiety than I did 5 years ago.
I think it's the basics,
Yeah.
and then there's a 4-part thing I do when I see something that stresses me out. It's usually not accepting something, right? It's like, damn. Or you have some expectations of yourself. Like right before this podcast, I was a little anxious. I didn't know do we have enough material to talk for an hour about this. I always get, before I do a surgery, I'm a little anxious every time, and I've done these things thousands of times. I get a little anxious. So I go, all right, where is it? So the first step is self-awareness. I got to acknowledge it. And then I sort of like get like, I always ask for like it to be taken away. And then I find somebody I can talk to about it. I'll call a friend. I go, hey, Todd, I'm a little anxious about doing this thing here. What do you think? And then I get out of myself and I find somebody else I can help. So that's a four-part process. Acknowledgement, ask for it to be removed, find someone I can talk to. And the big key, and this is what you and I get to do every day, is find somebody to help. And that slow down part that you said, I used to rush through patients because, I was talking to them and walking down the hall at the same time when they were in the treatment room. And now it's like being present is so important with everything. And it's not just dentists. It's, by the way, I just did a little research on suicide in dentistry because I thought we had a high suicide rate. We don't. Coal miners are much higher. All
Yeah.
right. Carpenters much higher. High tension wire. We're not even in the top 20, but we've been, I thought we were up there. Someone said that's not true, Mike. And so I looked into it and we weren't there. But it is a stressful job because part of it is because of who we are, the kind of people that are attracted to it.
Yeah, yeah, that's how we're wired, right? That's how
Yeah.
we're wired. And yeah, so let's just one more time summarize it. This it's mindfulness is self-awareness, rest, nutrition, sleep, 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 sleep. I can't, think about your nutrition and your sleep, number one. And if you think you're deprived, you probably are. And if you think you're not deprived, you probably are as well. So
Yep.
understanding that there's all kinds of tools today to help you figure that out for yourself. Because I think that one thing as a dentist owner is you are the leader, right?
Yeah.
You have to be a good leader to have a successful practice or a successful organization. So you've got to become a better version of yourself. You've got to
Yeah.
be able to um, lead by example and show that you can manage stress. And when the day's not going right, how do you pull it together to get through that day as a team to make sure you're treating those patients the best you can? And I think you brought up something that I don't stress enough, but it's so important is really thinking about helping yourself first, right? You got to give yourself permission to ask for some help. And that's that acknowledgement phase you just spoke about,
Yeah.
allows you to move on to the next until you acknowledge that you need a little help here to lower your anxiety or make a better decision or help a teammate or help a patient, help a colleague. Until you acknowledge, it's hard to move on to being productive. So I think that's critical.
I want to make one more point, and
Yeah.
it's one I've been making all week with my team. So there are four people I'm going to talk about. Yourself. The most important person to take care of is yourself. That has to come first. If you're not taking care of yourself, you can't take care of others. And in our practice, in a lot of practices, it's the other doctors. It's myself first, the team that surrounds me, and I know that's very important to you, then the patients, and then the referring doctors. So they're at the bottom of the list because my team, if I'm not serving my team well, then they're going to fall apart. If my team's not serving our patients well, they're going to fall apart. And then if we're not serving the patients really well, then the doctors aren't going to want to refer to them. So that's the way I look. Sometimes we look at the professional relationships are the top. They're very important. I don't say they're not important, but
Yeah.
it starts really with that team, and the team is
Right,
essential.
for sure. I mean, if the wheels come off your team, then you can't help any of those other people. And
No.
and the wheels are probably going to come off more often if you haven't taken care of yourself.
Yeah.
So I think that's a great point. And yeah, so we're running past 60 minutes here. I want to be respectful of
Sure.
everybody's time
Open up for
and I'm
questions.
open up the questions. Jackie, if you can help with that, if you're still hanging in there, and I'm gonna just see if I can open up the chat room. Um, yeah, so please in the chat room, ask some questions if you could. Ron Hickerson, if you want anybody wants to come off mute, go for it. I'd love to hear Ron talk about the light side, something that he thinks has helped him tremendously. That's Kyle's program. It's changed, it's morphed a little bit now, but there are resources. again, through Kyle and Martin, through the ADA right now. We're even going to be running a couple webinars, hopefully next year, for periodontist specific, and practice management includes mental health, right? How about that? I think one of the biggest travesties in dentistry, as being small business owner leaders, we are completely ill prepared.
Yeah.
We have one seminar a year in residency on practice management, and it was usually an accountant or a lawyer, a consultant of some sort
Yeah.
that came and give us an hour lecture as a joke. And then we're supposed to go out into the real world and be the owner leader. So we need more of the practice management help that isn't out there. And what better people to give those talks than people like you and me, right? That have been successful with a growing organization over a long period of time. We may have had our down points and impediments and bumps on the road, so to say, but we did figure out how to get through those things, and it usually was by someone else's help, right? Someone
Yeah.
around us. Like for me, it's been Mike McGuire, right? Mike and I have been an amazing partnership that listened to each other and used each other's mindfulness to carry on and lower stress. So partnerships, we didn't talk about that too much, but in dentistry, they're not very successful. If you look at the data on partnerships, there's more failures than successful partnerships. So when you find a good partnership, it's a powerful, powerful tool. It's that whole 1+1 is infinite. It's not
Right.
two. It's much more than that. But you got to work hard to find the right match, just like in a marriage, right? You got to work super hard to find the right partner to function well when things aren't going well. That I think is the secret for Mike and I, is that when things got tough, and we're blessed, it hadn't happened very, very often, but when things got tough, we rallied around each other and were able to pick each other up and keep the team moving forward. Let's see if we got any questions. None. Is Ron here? Let me see if Ron's here. I'm going to call him out again.
I can ask a question.
Yeah, go for it.
So Dr. Sonic, what kept you going when you were at rock bottom, when your septic system went out and you were like crashing and burning? Why didn't you give up?
Well, I think part of that is just my own DNA. Um, I never give up. So that's just who I am. But I was miserable when I was not giving up. So I don't stay miserable right now. I don't stay. I do get miserable sometimes, but it does not last. It never lasts 24 hours. It's usually less than that. But at that time, I just kept on doing it. I mean, I went through a lot of problems before that. That was just the one I talked about. I mean, the day of my mother's funeral, when I'm dressed up in a suit, going through the septic system, I'm thinking like, damn. But I also had a 2-week-old daughter. I wasn't going to give up on her. Um, I will say this. I'm fortunate. I don't suffer from depression. I have other issues. I very rarely am depressed. I get anxious and I end up feeling less than and beat myself up. So I always push to try to get out of that area. But that's a good question. And I don't think anyone's ever asked me that before. But again, I don't usually give a webinar like this either and talk about personal stuff. And by the way, you can multiply what I told you by about 20. I didn't even share all of it. I mean, because I don't do that in publicly. But I think I've told it enough to know that, I hit some bottoms there.
Yeah. Yeah. And then,
Yeah.
that's kind of the impetus, is that,
Yeah.
Mike has had great successes, and most of us in the perio world, we think that he's made all the right decisions and everything's worked out just perfectly. And the fact of the matter is that that's not true. And he's willing to share that with us. And everybody out there should know that yes, we've battled really hard to become successful, and the battle is never over. But you learn your own coping mechanisms. You learn what works for you and that can carry you through. And
I mean, there's going to be more problems in my life. The next is going to be unexpected. which I won't cause. It will be completely something unexpected that happens. It could be something in my family or some catastrophe. And then the last one, which may or may not happen, is the aging process. How am I, and I think about that a lot because I want to live to 130. So that's my number. So how am I going to stay healthy to 130? Because I have 2 or 3 friends with neurodegenerative, neurologically degenerative diseases. My brother-in-law just died of Lewy body disease, and my mentor Abe Schuster has ALS, and I go down and see him about every 3-4 months in Atlanta, and that could happen to anybody. You just don't know what's going to happen like that. And I always think about how will I handle something that I can't control, like that,
Yeah.
physical.
Yeah,
And
that's the same for me. My dad died at 54 of a heart attack. My mother died at 77, 78 as Lewy body dementia. So,
oof,
yeah, I mean, I'm haunted by these things. And,
yeah,
I was at Dental XP speaking this past weekend, and even though he's in the same town, I very rarely see Douglas Terry. He's an amazing dentist,
right.
and he's getting older, right? Like we all do.
Yeah,
And he made a powerful statement up there is that he's devoted himself to his conditioning right now because he's like you, he wants to live a lot longer. He's got a lot more to give. And if he doesn't take care of himself, his mother, I think, is 93 or maybe even older, but
yeah,
she's still working out 3 times a week. I mean, really? So,
yeah,
but that's what you got to do. You gotta be more cognizant of the value of sleep, nutrition, and stress reduction.
yeah,
Those 3 things can really extend your life. Right now we're finding out so much about how um, sleep disturbances, again, not necessarily apnea, but even resistance or disruption of quality sleep is leading to many of these diseases in children, ADHD, anxiety, but many of the diseases of aging. The oxygen deprivation of the brain and the circulatory system is not good for you. And if we want to live a long, healthy life, we've got to be really focusing on those basic tenets that we've discussed tonight, and that's quality of sleep, nutrition, and stress reduction.
yeah. No other questions? We have
I
a
cannot
right.
believe it. Everybody's held on there tonight, but everybody's pretty quiet. So,
Hey, Todd.
yeah, Ron, there you are.
Yeah, sorry. My dog is kind of going crazy tonight, another stress level. When I get home, so I try to get on a couple times, but the dog just keeps yapping. So I finally came outside and left her inside. But anyway, yeah, just speaking about Kyle Stanley and his program, um, the reason I was in one of his first groups and the reason why I got on was I lost my partner through retirement, and at the same time, COVID kind of happened, and so we were shut down here in Houston for 6 weeks, I believe, and I found myself like, what am I going to do? I'm sitting around driving my wife crazy because I'm worried about a lot of stuff, and so Kyle kind of opened up my mind to really, for me, more spiritual kind of things. Uh, letting God kind of come in my life and really filling my life and seeing things from a different perspective rather than the day-to-day toils and stresses that I have. So I would recommend Kyle's course very highly. Like Todd said, it's kind of morphed into more things, but when I took it, it was very basic. He went through some different channels and different programs, but made me think a lot about who I am, what I'm here for, my purpose, my why, and it really, really strengthened my point of view. And I also consider Todd a mentor of mine, and also Mike, his partner. We've been working together for years, and I'm so grateful for that too. So I just wanted to chime in here. So,
Thanks, Ron. Yeah, so
yeah.
much. Yeah, I think one thing that resonates, I think, with everybody is that a lot of us, you, Mike, and myself, and a lot of the people that have been blessed to succeed with our profession enough to then give back through education and public speaking, is that that has to come with a certain level of passion, right? Passion is
Yeah.
this driving power that we have to be important, right? It gives us an opportunity to feel good and rise up, right? Rise up to the occasion and give back in a powerful way. But without purpose, passion's just that motivator. When passion leads to purpose,
Yeah.
that's when we're really, hitting on all cylinders, and that purpose provides impact. And that impact can do a lot. It can move mountains, right? When it comes to education or mentorship, teaching students, inspiring folks to get on to the next level. I think that's something that you're gifted with, and I sure know it drives me now more than anything is using the passion we have to have impactful purpose.
Yeah, I think Ned just talked about that, the why. And, one of my mentors, Dan Sullivan, says that you always have to make your future brighter than your past. And he's 82. So he wants to live to 156. So no one's lived that long. But if you're 82 and you think you're going to live to 156, you're not a typical 82-year-old. So you got another 70 years or so to live. So a lot of people, especially my age now, and Mike and I, your partner, talked about this at dinner. It's like, we're not slowing down because we're enjoying what we're doing and we're creating still a bright future. And it's not always easy to do that. And I notice a lot of people my age, and I also younger. I remember when I was 30 years old, one of my dental friends says, I can't wait to retire. I want to retire at 50. And at 50, he didn't have any money. He had to work till 60. So he was miserable for another 10 years. He never had a passion or purpose. And it was like a sad life. Somebody asked a question. I don't.
Yeah. How do you make those around you feel appreciated? Wife, staff, members, kids? It's a great question. Let you tackle that.
All right. It's a big part of what I try to do on a daily basis is to, my tagline in every one of I do a YouTube video every Wednesday, and my tagline is always be the gift. And that wasn't my own. I got that from somebody else, another one of my mentors. So I always try to make somebody around me feel good. I always try to make it about them, not about me. And by making it about them, not about me, I actually get more out of it than if it was just about me. Like you were talking about, yelling at your kids or trying to get your team to do something. So I just appreciate them. There are a lot of specific things we do. Just I leave notes for my wife. I'll buy her flowers. Not on Valentine's Day. Do something special. My team every day. I have 20 people in my office. I try to connect with each one every day. Just something quick. And we try to do things for them to make them feel very appreciative, buying them lunches, making sure that they're okay, giving them whatever they need. I think that's a big part. Team building is a big part of what we do in our practice. And I like doing it. Right now we have a couple of internal problems that have been, I'm only there 2 days a week. And my partner has been out, and there's been we have a new office manager. There's a couple little fights going on that when I'm not there. And so that's unusual for our practice because we work very hard on our core values, which is becoming very servant-hearted and good teammates. And so I have to now bring them all in and talk to them nicely and say, hey, what can we do? In a very nice way. We have a whole bunch of ways of doing that. And I acknowledge if there's a problem because we don't have any tolerance for people not, loving each other. It really all comes from love and love and compassion. And
lead with the heart.
Yeah. You got to lead with the heart, not the brain. Most people's brains, nobody thinks with their brain. They get emotional, right? You get to someone's emotional center, and it's the limbic system. You connect with someone in their limbic system, in their amygdala, and you say, "Hey, what can I do for you today? Thank you so much." Even if they do a bad job, thank you. I know you. I have somebody we move people around like you do, Todd. So we have like little project managers, and I have my project manager for my study club, and she's struggling because it's not her strength. And I said, you're doing a great job. And I know this is hard for you, but just look where you were 6 months ago. You've gone so much. And I acknowledge that she's doing a good job and she's doing the best she can. She's not doing as good a job as I would if I was doing it, but I can't do it because I'm busy doing something else.
Right.
That's the thing. That's the thing. A lot of business owners and leaders and people. I started my practice. I built every one of my offices. I was the GC on 4 different offices. I know everything about the dental office, but I can't do everything anymore. I can only do 2 or 3 things. So the people around me have to do that, and I have to acknowledge them. I'm dependent upon them if I'm going to be successful. But
Yep.
more importantly, I'm dependent upon them if they're going to be successful. So my goal is to get everybody to rise up at our practice. Not just me, but them. When they rise up, we rise up.
Yep. Yeah.
Rising tide lifts all ships.
Yep. Absolutely. Yeah. I mean, that's great. It's a great finishing point, Mike. I can't thank you enough for spending the time with me. I know how busy your life is, and
As busy as you.
it means a lot to me to spend time with you, really, and hear you tell your stories, and your book has been an amazing contribution to dentistry.
Thank you.
I hope you know that. I think you do, but I mean, it's been an amazing contribution. I mean, and one of the first like it. So, yeah, keep going, my friend. You're not even close to being done yet. I know
hope
that.
not.
And
Not up to me.
I hope to come to your 130th birthday party.
That means that you're going to be something like what, 115 or something?
Something like that. Yeah.
Yeah. Hey,
Yeah,
I want to right back at you. I know how hard you work, and you don't need to do this. You want to do this, and this is a huge contribution. And you're just getting started with this. And anything I could do to help you, I'm happy to do that. Maybe we'll do something together get a whole large group to do
Yeah.
this, because this needs to be talked about.
Yeah, I love your idea about creating something that's maybe a little bit more private yet open, right?
Yeah.
That this concept of, like, because this is going to be shared to try to get people aware that there are people that are happy to host an hour every quarter and talk about this type of stuff in a very open environment, a safe environment, that helps people, even if they don't want to say a word, they want to listen. And maybe next time they'll speak up, right? I think there's a lot of power to that in the day we live in. But I also believe that in order to really help the people that need it the most, there needs to be a group like you're talking about, where it actually is, it's private. I mean, it's private, safe, closed, which provides this environment for people to speak up more freely. If they're on a Zoom like this, it's going to be broadcast. They're not going to say anything. They don't want to. That's not their cup of tea. But I think there's another method to do this that can be very powerful. So I'm all here to help whatever you can do. I think it's a mutual respect and understanding of let's all keep going and keep pushing each other, not only on the dental stuff and the practice management stuff, but this mental health, mental awareness is key. And I think in closure, something that's affected me since I was out at the SPEAR meeting a few weeks ago is our next speaker, our next guest on Rise Up #4 is going to be Riccardo Mitrani. And we're going to talk a lot about suspending judgment. I think that's going to be super exciting. And in listening to Riccardo today, comparatively to a year ago, before he started something he's doing right now, which is awesome. And I think everybody's going to find it very interesting, and of what his personal journey, what he's doing now, and where this is taking him is super interesting. And so I think everybody will get a lot out of that in July. We don't have a date yet. It'll be on a Wednesday night in July. And we'll get that out to you via our social media. For those of you that did join us tonight, please share this. This will be up on our social media pages, glimpses of it, and we'll give a link to folks to download the whole thing if they want to in the next couple weeks. So thanks everybody for joining. And you can always reach Mike and I. We're pretty easy to reach via email. You can get our email through our practice websites, and we are pretty much an open book.
Thank you.
Yeah. Thanks, Mike. Good night, everybody.
Good night.